Our next exploration in the series on Ericksonian strategic therapy is what I believe is the most important thing you can learn uh, from Milton Erickson. And to me, if you really grasp this, what it sounds very simple, but it's kind of complex to put it into practice, but you grasp this concept, uh, any type of therapy you do has to change, I think, for the better. And that's utilization. Utilization is something that Erickson used all the time. He used it in, when his regular therapy, his hypnotherapy, and a lot of those just kind of blended together with him. But you can use it, and I'll give examples of each way. So basically, what utilization is taking anything that the client gives you and using it or utilizing it as a way to achieve an outcome, a preferred outcome. So, a lot of times, Dr. Erickson would deal with resistant clients. And I'm sure if you've been in the field for more than 3 minutes, you probably had a client that you might have felt was resistant. But Erickson didn't see resistant clients. He saw people who were giving him a certain response. And so he would take their response, whether it's a cognitive, behavior, or whatever it was kind of response, and he would use that instead of being a barrier or block, use it as a way to facilitate change. So if somebody is not following their homework directives, rather than lecturing the person about why they're not doing it, getting on to them, doing a battle with the client, you might utilize what the client did do or did not do as a way to create a different shift in the way therapy is done. With hypnosis, when Erickson was doing his hypnotherapy, a lot of times clients kind of respond in unique ways. And rather than trying to mold them to do a certain thing on his command, Erickson would just naturally go and flow. We use the term co creative because that's what it was. Whatever the client gave him, he would use to guide them indirectly toward a different outcome. So, utilization to me is the fundamental aspect that most of this work is built on. Because utilization, nobody's a bad guy, nobody's doing anything wrong. It's just up to the therapist to have this wonderful ability to be flexible and to use what is offered to the betterment of the client in the session. So, just some examples to kind of give you an idea. If a client, I mentioned, not doing their homework, rather than getting on to them about their homework, just by telling them, okay, you chose not to do the homework. I'm really proud of you. That's great that you made the choice not to do the homework because you knew what was right for you. And I think that's so important that people follow what they want to do and that you can make really good choices for yourself. Now, to me, that kind of response is framing a couple of things here. It's framing that the client always has a choice. Secondly, if they have a choice, then they're the one who's choosing to do it or not, and that pulls a little more power to them, kind of empower them a little more. And third, there's no battle here. Hey, you made the choice, because to be honest, maybe they didn't need to do that. So just maybe assigning different homework and having a discussion with them helps to flow in a different direction, or assigning more and more of the same homework and to see how often they're going to not do it and say, I'm going to ask you to do it 3 times instead of one, just to see if you're not going to do it, whatever it is to interrupt the pattern. So Erickson would use what they're offering and kind of design treatment strategies to activate that inner resources inside them to start facilitating their own change. And hypnosis, a lot of times, if you've been working with clients, you'll notice that they do things that you're not telling them to do, or maybe sometimes they don't do things that if you're doing a direct method and you're telling them they don't do it, and it kind of feels like a bit of a struggle. Well, with Erickson, if the person he wanted them to, relax and close their eyes, he might give them a suggestion. You can always close your eyes if you're more comfortable. And if the person's like eyes are still open, instead of going, okay, go ahead and close your eyes, and their eyes are still open, and it becomes a battle, Erickson would just say, and keeping your eyes open is another way that you can just relax and go into trance. So whatever they're doing, if the person's fidgeting a little bit, small movements and shifts are a wonderful way to let go of tension. So again, whatever's being offered. If a client's incredibly angry in the session and they're getting upset, how can we utilize their anger to get them to do something? I had a client who was very irritated and upset about something going on in her life, and was kind of, it wasn't nearly angry at me, but, it kind of feels like it was coming at me. So just by saying something about, how passionate you are, and, talking about this passionate anger, and kind of moving her into some type of activity that we could channel that passion and anger to interrupt some of these limiting patterns she was using, instead of saying, all right, now calm down, now this is right, you got irrational beliefs and you're getting, you know utilize those things. Again, this is the most, I think, the most important thing that Erickson gave to us. And you find a lot of times once you get used to doing this, that therapy actually comes a little easier because you're not trying to force an agenda on the client. You are really handing something, and if they take it, that's fine. If they don't take it, that's fine. And you hand them something else, and they may take it, and they do something else, and then their action, begets your action, which begets their action, as opposed to, okay, this is a very linear approach. You've got to do this at this time in this way, or you're resistant, or therapy's not going to work, or maybe I should refer you to a therapist I hate, or I don't know. You know, so just start, playing with this. I'm trying hard to even put utilization more into my own life. When life doesn't go the way I think it should, just kind of utilize what it is. It's a bit of a struggle when when it's in your own life. But I think these principles that work so well for Erickson and the strategic way of doing therapy can be a benefit in multiple areas, in coaching and hypnotherapy and those kind of endeavors. So, again, next time you're with your client and they give you something, instead of saying, well, this isn't right, or this is what I expected, or all that, how's a way I can utilize this to really create the change? So if they're resistant, maybe encouraging them to be a little more resistant. This is where those paradoxical kind of interventions we'll talk about a little more later kind of come in, to where you're using it in a way to kind of collapse the problem on itself. So anyway, we're going to continue with more videos, and hope you're getting something out of it. Thanks for watching.